This particular slide goes over a special type of emergency. As a result of overconsumption, the liver gets very scarred up and overused and damaged, and what happens is that it gets harder for blood to filter through the liver, and what then happens is we have backward flow. I think we've all heard about backward flow when we talked about the heart and heart failure, CHF. So in this case, it's the liver that's causing this engorgement and backward flow. And when it backs up, you can see here from the slide, it backs up on the venous side, and it causes all of this engorgement around the stomach and around, as you can see, the esophagus. So as the esophagus is engorged with this venous blood flow, these veins can become very swollen and edematous. And if you have a lot of pressure and you have a lot of vomiting, it may cause these blood vessels to leach out or tear, and causes the blood to then backward out through the esophagus, and we'll have esophageal varices. Sometimes with this liver being so inflamed and this backward congestion, there's also other things that occur. We have fluid that's starting to leak out through the capillary system and leads to the belly becoming quite distended, called ascites. And that's just a lot of the liquid that is being drawn out. Now it's being drawn out from the capillaries as larger proteins enter into the stomach. Abdominal cavity is going to draw liquid, as it's a larger molecule. It's going to pull some fluid out. It also causes the umbilicus to then protrude a little and then have all these superficial blood vessels on the abdomen to become dilated and inflamed, which we call the capitis medusa. And you can do some YouTube searching and see those other additional pictures. However, we just want to go back that the engorgement of the liver disease, the person that is drinking quite heavily for years, has caused this backward flow. This backward flow then results in the engorgement of veins, the venous system, and the esophagus, causing them to later on to rupture, which is called esophageal varices.